Have you ever wondered why so many countries have universal healthcare? You might think it's just a modern political idea. But what if I told you its roots go back over a century to one of the deadliest pandemics in human history? Today, we're diving deep into the story of the 1918 influenza pandemic and how it completely reshaped the world's view on public health. The year is 1918. The world is exhausted, still reeling from the final, brutal year of World War I. But an even deadlier enemy was silently spreading across the globe. It wasn't soldiers or armies. It was a virus, an H1N1 influenza virus, often called the Spanish flu, though it didn't actually originate in Spain. Spain was just one of the few neutral countries during the war with a free press that could report on the outbreak. So they got the name. This flu was unlike anything anyone had ever seen. It was incredibly contagious and unusually lethal, targeting not just the very young and old, but healthy adults in the prime of their lives. Imagine bustling cities falling silent, with theaters, schools and businesses shuttered. It's a scene we've become all too familiar with recently, but back then, it was a terrifying new reality. Globally, the pandemic infected an estimated 500 million people, about a third of the world's population at the time, and claimed the lives of 50 million to 100 million people. That's more than all the soldiers killed in World War I. The sheer scale of the disaster was overwhelming. Hospitals were completely swamped, and makeshift ones popped up in schools and public halls. Doctors and nurses were in short supply, and many of them tragically became victims themselves. Families were devastated, with many children becoming orphans overnight. The social and economic fabric of societies everywhere began to tear at the seams. At the time, healthcare was largely a private affair. If you got sick, you paid for a doctor, if you could afford one. For the poor, getting sick often meant a death sentence. There were some charities and religious organizations that offered help, but there was no organized, government-backed system to protect the public's health. The 1918 pandemic laid bare the catastrophic failure of this approach. A virus doesn't care if you're rich or poor. When a highly infectious disease spreads, everyone is at risk. The wealthy might have had better access to care, but they couldn't isolate themselves from the rest of society entirely. They relied on workers who might be carrying the virus. The pandemic was a brutal lesson in interconnectedness. It showed that one person's health is everyone's health. Suddenly, governments around the world were forced to take unprecedented action. They implemented quarantines, mandated masks, and launched public health campaigns. But these were reactive measures. As the pandemic finally subsided, a profound question lingered. How could they prevent something like this from ever happening again? The conversation began to shift. Health was no longer seen as just a personal responsibility. It was becoming a matter of national security and economic stability. A healthy workforce is a productive workforce. A healthy population is a stable population. This is where the idea of universal healthcare really started to gain traction. One of the first and most influential examples of this shift happened in Russia. Following the 1917 revolution, the new Soviet government, led by Vladimir Lenin, established one of the world's first truly centralized, state-funded healthcare systems. The Commissar of Public Health, Nikolai Semashko, built a model based on the principle that the state was responsible for the health of its citizens. The goal was to provide free medical care to everyone, with a strong emphasis on sanitation, hygiene, and preventing epidemics. While the Soviet system had its own significant problems and was tied to a specific political ideology, its core concept that the state should guarantee healthcare for all was revolutionary and incredibly influential. It showed the world that a different model was possible. Other countries started to take notice. In the years and decades following the pandemic, many nations began to build their own systems. In Japan, the Health Insurance Act was passed in 1922, creating an employment-based insurance system. In France, social insurance programs were expanded. In the United Kingdom, the idea of a national health service, which had been debated for years, gained massive support. The Beveridge Report in 1942, written in the midst of another world war, laid the groundwork for the National Health Service, or NHS. It was founded on the principle of providing comprehensive care, free at the point of use, to everyone, regardless of their ability to pay. The shared trauma of war and disease had created a powerful sense of social solidarity. It wasn't just about providing doctors and hospitals. The post-pandemic era saw a huge investment in public health infrastructure. Things we take for granted today, like sanitation systems, disease surveillance, and public health departments, were all massively expanded. The pandemic proved that preventing disease was far more effective than trying to cure it after it had already spread. This led to the creation of international health organizations. The League of Nations Health Organization, the precursor to today's World Health Organization, was established to help coordinate responses to global health threats. The world was learning, slowly and painfully, that viruses don't respect borders. So, what's the takeaway here? The 1918 pandemic was a global tragedy of almost unimaginable proportions. But from its ashes rose a powerful new idea, that healthcare is a fundamental human right, not a privilege for the wealthy. It forced societies to recognize that we are all in this together, and that a strong publicly funded health system is one of the best investments a country can make in its own future, its economy, and its people. It was a catalyst that pushed nations to build the social safety nets that protect millions of people to this day. Of course, the debate over how to best provide and fund healthcare continues all over the world. There is no one-size-fits-all solution. But the next time you hear people discussing universal healthcare, remember its dramatic and tragic origins. It's a legacy born from one of the darkest chapters in modern history, a powerful reminder of why public health matters so much. Thanks for watching. If you found this story as fascinating as I did, make sure to hit that like button and subscribe for more deep dives into the history that shaped our world. Let me know in the comments what you think, or if there are other historical topics you'd like me to cover. See you in the next video.